Hello, everyone. My name is Melodyanne Cheng. I'm a third-year medical student at the David Geffen School of Medicine at UCLA. I'd like to first thank Dr. Joanne Giacconi for her stellar mentorship and support this year as I completed my Albert Schweitzer Fellowship in partnership with the Greater Los Angeles Veterans Affairs Medical Center and the West LA Eye Clinic. I spent my year of service working with the incredible veteran population of the Greater Los Angeles VA system, which I am very honored to have done so. LA County is home to the most veterans in all of California, approximately 330,000 in a 2016 count. In the VA Greater Los Angeles healthcare system specifically, African American and Hispanic patients often seem to have worse glaucoma cases than their white patient counterparts, but they don't seem to be getting to the operating room when they need it. And part of this issue could very well be innate to the VA system and the difficulty in rescheduling canceled operating dates, but we do expect that social determinants of health could be potentially affecting the baseline rate of refusal among the racial and ethnic minority VA patient population. As a result, this project, which is to assess this social determinants of health factors affecting rates of glaucoma surgery refusal and acceptance within the Greater Los Angeles Veterans Affairs Black and Hispanic patient population, came about as a way to potentially address medical mistrust via some educational programming to improve access to care and quality of life measures among Black or Hispanic VA patients with glaucoma. As I mentioned, the patient population would include all glaucoma patients who have refused glaucoma surgery as an intervention at the West Los Angeles VA during the period of January to December 2019. Our first goal was to establish baseline understanding of rate of glaucoma surgery refusal among Black or Hispanic patients in the West LA VA, and we did so via a retrospective chart review starting in January of 2019. And working forward. Our second goal was to understand the community's concerns and assess for social determinants of health affecting patient refusal rates. And we did this via telephone-based patient-centered surveys. Basically, when patients were offered the option of surgery in clinic in a prospective manner, we offer them the option to also participate in this survey. And it was a pleasure, honestly, to be able to speak one-on-one with the patients, whether they accepted or refused surgery. It was always such an honor to hear their thoughts and views and concerns. And then finally, the third goal was to develop and roll out educational programming to improve health literacy regarding glaucoma surgery. This is still a work in progress since we are still working on increasing the sample size of goals 1 and 2, but we hope to continue to see progress in this area as well, since this is a long-term project. Some exciting things that I would be proud to share with you from our retrospective chart review. We do have a preliminary baseline understanding of some of the counts from our glaucoma surgery refusal. We were able to review 65 total glaucoma patient charts from the 2019 to 2020 period. 14 of those glaucoma patients had been referred for glaucoma surgery. Some of them accepted, some of them refused. All of these patients were on the max number 3 of medications for glaucoma at time of surgery recommendation. Some interesting data points, race and ethnicity of the patients accepting or refusing surgery. Of all our patients, about 9 of them said yes and 5 of them said no. Among our Black and African American patients, we see 4 saying yes to 2 saying no. For our Hispanic patients, all 4 resoundingly said yes. And then for our white and or other patient population, we see only 1 saying yes and 3 saying no. For the number of visits between surgery recommendation and surgery date request, which basically means the first day that the surgery is recommended as an option for glaucoma, and then the day that surgery is actually requested in the system because the patient has consented. Among our patients, we see all patients on average take 2 clinic visits to officially go from the surgery recommendation to requesting that surgery. Among the Black and African American patients, we see on average 4. Among the Hispanic patients, we see on average 1. And among the white and or other patient population who say yes, we see on average it takes literally no visits because they are consenting to the surgery and requesting for that surgery that same day. For our patients' initial response to surgical recommendation, among all our patients, we see that 4 of them have said no and 6 of them have said yes, with the others trying to think about it or trying other treatments first. Among our Black and African American patients, primarily we see the biggest number, 3 of them saying yes, but 2 of them saying no. Hispanic patients, we see 2 saying yes, and then 1 trying other treatments. And then white or other patients population, we see 2 saying no, and then 1 saying yes and 1 saying think about it. For our patient-centered surveys, We also had some interesting insights to share. The purpose of these patient-centered surveys, as I previously mentioned, was to assess for the social determinants of health affecting patient refusal rates. So some of these questions, for example, how much control you feel you have over glaucoma, showed that patients on average did not feel like they had a lot of control. They did feel like they had a lot of support at home while recovering. They also trusted their glaucoma doctors a lot, but they didn't seem to know the names of their glaucoma medications very well or their uses. Fortunately, we found pretty reassuring answers when we asked whether they were worried about feeling discriminated against because of race or a level of education by their doctors or medical team at the West LA VA clinic. And then for an answer to our food security questions, for example, the one asking about food, buying just not lasting and not having enough money to get more, we did have patients answering that they did feel pretty food insecure. The third part of the project, which is to conduct educational programming, is in the future. We do plan to continue collecting more patient responses for both the retrospective chart review and the patient-centered surveys, since our sample size is still low. So it is an ongoing effort. And honestly, it has been a fantastic pleasure to work with the LA Albert Schweitzer Fellowship, and really inspiring to see my peers and my cohort continue to do such great work with their community site partners and in the community. One of my biggest honors and a huge thank you I'd like to say is it will be a fantastic pleasure to continue working alongside these inspiring fellows and all the mentors I've met along this journey this year and in the future as well. So thank you so much.